topic from my side. It is the fifth topic overall from the CT scan. So before starting the actual topic, so there was a question from Dr. Jethanan. Just to differentiate between the chronic and the acute subdural hematoma or the bleed, basically on the CT scan, we can see here on the right side the bleed which is acute, which is new bleed, will appear as the hyperdense, as we can see in this picture. Whereas on the right side of the screen, we can see a chronic bleed which actually turns dark in the color. And sometimes there are different varieties of the chronic subdural. We can see we can have the acute on chronic bleed, in which we can see the differentiation, both the chronic, the darker one, as well as the acute bleed. So that is the major difference between the chronic and the acute bleed on the CT scan. As the days will go on, the subdural will turn more darker. Now coming to the actual topic, CT scan spine neuroanatomy. So for this, we have to study a bit of anatomy. So for interpreting the radiology, one needs to have a good knowledge, sound knowledge about the anatomy of that particular part. So let's first talk about the indications of CT spine. CT scan spine, it has a very good role in the trauma. Again, similarly as the brain, in cases of the trauma, when we are suspecting any trauma to the spine, the first investigation that we usually go for, that is the CT scan. That is the gold standard, which is going to tell us about the integrity of the spine. Is there any fracture, subluxations, or any kind of bony pathology that will be well defined by the CT scan. In other cases, elective cases in degenerative disease, we'll talk about them, those changes or the disease in which the CT scan has a very good role, and it can tell us about the opacification, calcifications, or the bony, different kind of bony pathologies, the vertebral height. We have to look for the vertebral height, the spinal curvature, canal diameter, and the different joints, fractures that can be picked well on the CT scan. To read or study about the spine, MRI is the gold standard, which will tell us about more about the spine, the actual the spine, spinal cord, and theca can be appreciated on the MRI. CT scan is just going to tell us about the bony anatomy. So in elective cases, it has limited role. MRI is a more suitable or first investigation that we go for, only in the degenerative changes. When we want to pick the degenerative changes, we'll go for the CT spine as well. So first talking about general principal general anatomy about the spine, we'll start from the cervical spine, and we can see that these are the natural or the normal curves. We start with the cervical region, in which there is the lordosis, the anterior curvature, the posterior curvature in the thoracic spine, known as kyphosis, and those curvatures are going to repeat in the lumbar and sacrococcygeal region. In lumbar region, there's lordosis again. In the sacrococcygeal region, there would be kyphosis. If any of this curvature is lost or reversed, it is an abnormality that we usually see in the cases of back spasm, when the curvature, or in the case of any trauma, the curvature is lost. So that is an abnormality. That is the one important thing that we'll look for in the CT spine. We'll see in the next cases. Similarly, as we talked before, there are three important planes in which we get the CT scan. So starting with the coronal, in cases coronal cut. In cases of the coronal cut, we actually want to see if there is the loss of curvature. Usually the spine has to be straight, completely straight, but as we can see in this cut, that the spine has curved. So this is known as the scoliosis. When the When on the curvature on the coronal plane is lost, that is known as the scoliosis. Similarly, we'll see in the sagittal cut if the curvature is lost or not. So looking at the different views whenever defining the pathology, defining the radiology, looking at the different views is very important. Coming to the vertebral body, this is the normal structure of the vertebral body. We'll start it from the anterior most part, that is the vertebral body. Looking at the axially or the transverse section of the vertebral body. This is the vertebral body that is connected via the pedicles. Pedicle means feet, and via the feet or the pedicles, it is connected to the transverse process on the either side, and then at the back there would be lamina, which connects it with the dorsal process. Right, so any vertebral body has a body which is connected via the pedicles to the dorsal process, via the lamina to the dorsal process, and in between them there is the canal. This is the canal in which the spinal cord or the theca will run. Looking at in the lateral view or the sagittal view, again we can see start appreciating from the vertebral body. Vertebral body has the superior end plate, it has the inferior end plate. Similarly, it has the superior facets for the making the joint with the upper vertebral body, the inferior facets for making the joint with the inferior vertebral sorry, these are the superior articular facets, and here are the inferior articular facets for making the joint with the upper and inferior vertebral uh, body. This is actually the costal facets in the thoracic spine for the attachment of the upper and the lower rib. And this is the dorsal process. Transverse process we cannot see because it is the lateral view. This is the vertebral notch, which is going to make the foramina when combined with the inferior vertebral body, from where the nerve roots will traverse or pass from. Now, these are certain major differences between the vertebral bodies as we move from the cervical region to the thoracic and the lumbar region. In the cervical region, the body shape, usually it is the body size of the body is larger one. It is oval in shape. Coming to the dorsal, it is large and it is heart shaped. In the dorsal region is the heart, so it is heart shaped. Similarly, in the lumbar region, there's the kidney, so it is usually kidney shaped vertebral body. The vertebral foramina in the cervical region, it is triangular, and the important things from the anatomical point of view, as well as from the pathological point of view, is that cervical has a large canal, so comfortably the spinal cord passes through it, whereas the dorsal process has the dorsal vertebral body or the thoracic vertebral body. I'll be calling the thoracic vertebral body or the dorsal vertebral body, both are same things. So the canal here, it is a narrow one, and so the spinal cord, even a minor injury to this dorsal region can cause the damage directly to the cord. So we need to be careful whenever we are operating on the dorsal spine. When we come to the lumbar region, in the lumbar region, the canal is flattened and again it is triangular shaped. When we talk about the transverse process in the cervical region has a foramina that is for the vertebral artery. This is known as the foramina transversum or transverse foramina. The transverse processes in the dorsal spine, they are usually long. Coming to the lumbar region, the dorsal processes or the transverse processes are shorter one. The transverse processes in the lumbar region are shorter one. When we talk about the spinous process or the dorsal process, The spinous process in the region of the cervical, they are usually bifid, starting from the C2 till the C6, C7, they are bifid. They are divided into two portions. Whereas coming to the dorsal region, there is the longer dorsal processes. They usually have longest one dorsal processes. Coming to the lumbar region, the dorsal process is usually flattened and pointed like this. We'll see in the other cuts. This is the same picture that we can see now. We'll appreciate that same the same things on the CT scan. Here we can see just a sec. Okay. So here we can see these are the foramina, and that's how we can identify this is the vertebral body. CT scan axial view at the level of the cervical region, because we can see the foramina. Again, we can see there is a large central canal for the passage of the vertebral body. Coming to the dorsal region, there's a shorter canal. At the same time, we can also appreciate here the rib. This is the rib passing on the either side, so that signifies this is the dorsal region. Coming to the lower lumbar region, I think this is the same dorsal process. I have taken it twice. So here you will not find the rib. This is the same picture that again I have repeated mistakenly. But in the lumbar region, we can see the canal would get large. The transverse processes would be shorter one as compared to the dorsal spine, and the canal would be bigger. Okay, now starting from the cervical region. In the cervical region, this is an X-ray. For the normal curvature, we usually see the four important lines. Anterior vertebral line joining the anterior vertebral bodies, and just at the back of the vertebral bodies, this is the posterior vertebral line. And when we combine the dorsal processes, this line is known as the interspinous line. Interspinatus processes between the spinatus processes. So this is the third important line that we see, and in between there is the spinolaminar line, which is actually the joints between the cervical region. So whenever we talk about the cervical spine and anatomy radiology, when we are defining it either on the X-ray or on the CT and MRI, we have to define these lines. These are going to tell us about any fracture, subluxation, dislocation, or even the fractures can be identified by looking at these four important lines: anterior vertebral line, posterior vertebral line, spinolaminar line, and this interspinous line. Next important thing is that in case of the C1 and C2, C1 also known as the atlas, as it is bearing the weight of entire our skull. Important thing is that it has no vertebral body, but it only has the arch, anterior arch, and the posterior arch. The vertebral body embryonically has been combined to the body of the C2, and together it forms the dens or the odontoid process. So looking at it, this is a just a very beautiful AI created picture, but we actually, when we see it on the CT scan, so in this scan, the sagittal view, we can see here that this is the anterior arch of the C1, and this is the posterior arch of C1. It has no vertebral body. The part of its body has combined with the C2. This is the tense or the body of C2. This is how we identify, and that's how we start counting the vertebral bodies, right? So this is the part of the CT brain. This is the clivus. This is the occipital part of the brain. This is the foramen of magnum, and from here we start looking at the spine. So for counting, we can start whenever we see the odontoid process. It is the C2. C1 has no vertebral body. It has just the arches. So this is C2. This is C3. This is C4, C5, C6, C7, and so on. T1 and T2. At the same time, again, we have to look for this is the anterior vertebral line, and this is the posterior vertebral line. Important thing to notice here is that usually the cervical spine should have the lordosis, but here we can see as the spine has straightened up, so this is usually signifies there is a spasm. Again, that's why remembering the lines, cervical spinal lines, is very important. We can see here it has straightened up, which usually should have curvature. Going to the coronal cut, and in the coronal cut, again, we can appreciate here, it is the C2, and this is the odontoid process. This is the C1, which does not have any vertebral body, does not have the vertebral body. On either side, we can see the arches. This is the C2, and then we can start counting C3, C4, C5, C6, C7, and this is the T1 from where the first rib is starting. These are again, this is the third view that we have not commented on right now, till now. So this is the coronal cut in which we can identify easily the C2, C1 arch. Sagittal view, we can see this is the odontoid process, this is the C1 arch. And when we look at the axial cuts, just by looking at this odontoid process, that is actually coming into the canal of C1, we can differentiate, we can appreciate here the foramen of transversum on the either side. In the transverse process of C1, there's no vertebral body of the C1, there's just the arch. This is the posterior arch, and in the canal, this is entirely the canal. In the canal, in the mid, we can see the odontoid tip. So that's how we can appreciate this is the level of C1. Going below from the cervical region to the thoracic region, for counting or coming into the thoracic region, there are two easy ways. Number one would be to obviously count the C2, which is the most definite way. Starting from the C2, we can appreciate, count it down till the T1, going down till the T12. The second way would be to count the ribs. Sometimes there is the extra cervical rib, so this is in not in all cases it is a definite way. So identifying the odontoid is a more suitable or better way. This is the coronal cut of the dorsal spine, and again here we can see the presence of the rib. Again, looking at the symmetry or like looking at the angle is very important. As we here you can see it is completely straightened up dorsal spine, which is the normal one. And if there is the loss of curvature or there is the lateral curvature, that will be known as the scoliosis. We can comment here onto the vertebral body, the disc spaces. When we look at the axial cut, which is a very important one, as we want to see that is the canal compromised or not, even in the fractures that we'll talk about in the next topic, the basic pathology. So we have to look for this is the vertebral body, and these are the transverse processes. This is the dorsal process. These are the lamina, and these are the pedicles. So we have to look for the canal. If there is any pathology, for suppose a fractured part or any bony tumor that is compromising the canal, that is going to eventually cause compression over the cord. So looking at the normal canal and the normal structures, bony continuity, that is very important in the axial as well as the coronal and sagittal cuts. This is the lumbosacral region. Okay, so coming to the lumbosacral region, starting from the axial cut, again the same repetition. I am repeating again and again, so one should be fluent in identifying the normal structures. This is the vertebral body coming to the dorsal process. These are the pedicles coming back. This is the lamina, and this is the dorsal process. And this is the canal that we have to look for to pick up any pathology. Coming to the sagittal cut, these are the vertebral bodies, and these are the dorsal processes of the subsequent vertebrae. Again, we have to look for the canal. If there is any compromise, any bony part, any tumor that is going into the canal, looking at that is very important. We have to look for the normal curvature. Here again, it is lost in the case of the lumbosacral region. This is the sacrum. In the sacral region, we'll see if there are no disc spaces. If there are no disc spaces, so this is the sacrum, and this is the L5. This is the way of counting down the vertebral bodies. If we start counting it from the uh, lower portion, so we have to first of all identify the sacrum, the combined vertebral bodies which make the sacrum, and then we start counting. This is L5, L4, L3, L2, and L1. Next we look at the coronal cuts, and here we can see we can comment on the vertebral height, on the disc spaces, or any fracture. The surrounding structures can be seen. This is the sacral promontory, and this is the 3D constructed lumbosacral region scan. Okay, so that's it from my side. This is the quotation in the life. The last, the spine is the tree of life, and so we need to respect it. Obviously, our postures and sitting position, straining over the back, that really matters. So, thank you so much, and God bless you all. If there is any question, so you can ask.